Whether you're feeling something, be it a cough, tiredness, pain, swelling, or you feel great, both of those people probably should see some kind of doctor at least once a year, have a review. If you have a concern, voice it. Even if something seems small, that doesn't mean that it isn't something that needs to get looked at, and sometimes small things do turn out to be important too. Just because you feel good doesn't mean there's nothing going on. A lot of stuff is silent, and even if there's something small that's just nagging at you, it's something that could absolutely be valid to talk with somebody about, and there's no shame in that, be it a physical ailment or even mental health ailment, which a lot of people try not to emphasize mental health in terms of depression, anxiety, or any kind of thing like that. It is something that is still valuable to get looked at and talk about and potentially get treated. Have something that's small but really, really common that I see a lot of is sleep apnea. Sleep apnea is one of those things that people almost laugh about, that I snore a lot, or my wife says I snore a lot. I feel maybe a little tired, and that usually feeds into blood pressure being high. But I'd say that maybe that's perhaps the number one that is more common in men. Women get it too, but tend to get it more. And sleep apnea will drive up your blood pressure. You'll feel exhausted even if you sleep, and it is a driver of heart disease. So that's maybe something that people would almost laugh off about their snoring. But sometimes, whenever I hear that, I kind of get a little alert in my brain, like maybe we need to work on this and look a little deeper, frankly, that often can feed into longer term issues. Is this person going to get a heart attack later in life if we don't address this sooner? The biggest things about staying healthy, if I may say, are really don't do things we clearly know are harmful. That's probably the number one. The top one probably is still smoking. Cigarette smoking is still a huge driver of illness and death that is preventable, be it from cancer, be it from heart disease. The expenditure is a harsh thing on a lot of people's budgets that, frankly, are tight now anyway. So I'd say watching smoking, reducing smoking, eliminating smoking, or any tobacco is probably the biggest one. New Mexico is a big drinking state. Alcohol can be a big one in terms of people's health. That can be maybe drinking even a little extra than you think. 3 or 4 drinks can be on the high side, and plenty of people drink more than that. And even though they may get a hangover and then recover, that does not mean that it's not causing harm. It can affect your liver, affect your heart, affect your kidneys, affect your brain. It can cause long-term damage that can be silent, that needs to get looked at. My biggest things would be smoking, drinking, any drug use. Frankly, sleep is one we don't think of. I try and emphasize give yourself time to sleep, have good sleep habits, avoid too many screens in bed, because sleep actually affects your immune system, it affects your mood, it affects your blood pressure, a little bit of everything. So don't harm yourself, namely. Get good sleep habits, and just day to day, what are you putting in your body? Eating wise is, of course, important in terms of sugar, flour, fatty foods. Are you eating out versus making your own foods? Are you eating enough fiber? Is it a good variety of foods? A lot of it is very simple on a day to day basis. Really, a lot of what happens to you is what your day to day habits are in terms of what you put in and how well you treat yourself in that way, I'd say. To prevent illness, to promote health, the biggest thing that we haven't said now, I'm a big proponent of vaccinations, especially on older individuals, people with health conditions. I think that's really important. COVID, flu, RSV, pneumonia do kill still thousands of people on a regular basis. So if you are, say, over 65, you have health conditions, you have someone frail near you who you just might be around, you might want to get a vaccine to prevent those sorts of things. Anyone can get severely ill, so I encourage, frankly, everyone to get vaccinated, but especially if you're higher risk, even though people might not want to think of themselves that way, it's one of those things that, yeah, it's a bother, it may be annoying, but I do still emphasize as a relatively low risk and potentially high rewards thing to do for yourself.